Hello everyone. Today's video is about phasing onto natural agents from being on pharmaceutical anti-inflammatory agents, or maybe phasing off of anti-inflammatory agents entirely. As per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So someone had posted a question on one of my videos, someone who has actually posted quite a few questions on my videos, but hasn't posted in quite a while, so it's nice to hear from them again. And they were basically saying something to the effect of they've been trying to taper off of hydrocortisone and been trying to do that for a while, and they're just wondering how that could be facilitated. And so happy to answer that question, but I thought I'd make it a little bit more broadly applicable, talking about other types of anti-inflammatories too, like folks that are stuck taking, ibuprofen / Advil, or maybe taking prednisone for, various reasons, or, whatever it happens to be. So this is kind of a broad spectrum tapering off or transitioning off of anti-inflammatories. Now, there are certain conditions where pharmaceutical anti-inflammatories are just the only thing that seem to keep symptoms at bay. So that does happen. And for really extreme cases, really hard to treat cases, sometimes we need those drugs. And that's why I am not anti-inflammatory drugs in any way, shape, or form. I think they're wonderful when used appropriately, and they can really, really help people. But there are certain side effects, of course, that can come along with them. I've had patients who have been stuck on prednisone for years in some cases, and it's not good. Like, it gives them diabetes. It causes them to gain a lot of weight. Like, it can really muck around with their adrenal glands. So it's not ideal. So if we can get them off of those medications, it's very good. Or patients who get a lot of benefit from being on, say, ibuprofen or naproxen, but then it really bothers their stomach, and so now they're taking a PPI and trying to protect their stomach lining. And it's just really sometimes the side effects are challenging, and then sometimes they're not. So it's, anyways, there's different strokes for different folks, different scenarios out there. Long and short of it is that, how do we transition, or how do we taper? Now, it may seem a little bit obvious, but I'm going to say it because I want to be thorough here. Ideally, we find what's the root cause of what is driving the condition in the first place, and we address that, and then the inflammation goes away, and then they don't need to be on a pharmaceutical or a natural agent. They could just be on nothing. That is sometimes easier said than done, and for certain conditions, like autoimmune conditions, for example, when the horse has already left the barn and the immune system's already attacking the tissues, then sometimes the root cause, maybe the gut issue, or the systemic infection, or whatever, like microbe, or sometimes we just don't know what the trigger was for the autoimmune condition. We can treat that till we're blue in the face, but the immune system's still freaking out and attacking the joint tissue, or attacking the nerve, or attacking the skin cell, or whatever body part is getting negatively impacted by the immune system. So in that case, we have to work with immunomodulators. But in a number of cases, many cases, if we remove the specific food sensitivity or food sensitivities, or we treat the gut microbiome and get the dysbiosis, like the SIBO or the LIBO or the yeast overgrowth, under control, we heal up the gut lining, or we treat the systemic infection that's actually driving the underlying symptoms, then we can see a improvement or resolution of the condition, and then the patient doesn't have to be on anti-inflammatories anymore. So that does happen, but just not all the time. In other cases, as I just referenced, we really need to focus on the immunomodulation piece, and sometimes treatments like low-dose immunotherapy, LDI therapy, which I've posted many videos about that before, so please feel free to cross-reference those if you're interested in learning more about that. That can be really helpful for a lot of autoimmune conditions, other sort of post-infection inflammatory issues, like folks dealing with post-Lyme disease syndrome or post-co-infection issues. So anyways, that can be a very useful adjunct. Other immunomodulating agents like medicinal mushrooms, beta-caryophyllene, N-acetylcysteine, curcumin would fit into that category. Molecular hydrogen would fit into that category. Ozone therapy would fit into that category. So those types of agents can be very helpful to help modulate the immune system over time. They can take a while. Immunomodulators can be fast. They're usually not that fast, unfortunately. It can take it can take sometimes several months. I've had patients where, oftentimes they'll say it's probably going to take anywhere from 3 to 12 months to really modulate your immune system down. So that can mean just a very gradual taper of the pharmaceuticals or natural agents that they're using to keep the inflammation levels under control. But if patients stick with it, again, not in every single case, but in a lot of cases, we can see a lower need for medication over time. We're going from, say, oh, I needed prednisone to keep things at bay, and now I can get away with, say, just taking my boswellia or my curcumin or something like that. On the topic of boswellia, that kind of brings me to the next category of, depending on the underlying issue, the patient might be able to phase from a pharmaceutical anti-inflammatory to a non-pharmaceutical anti-inflammatory, which generally the natural agents don't have side effects. They can, but they tend to be quite a bit less common and are usually less severe. And so boswellia, also known as frankincense, that's one of the agents that I really like the most in my practice. I've seen a lot of good results. The trick with frankincense / boswellia is dosing it high enough and then making sure it's a standardized extract. So when I prescribe or recommend boswellia for my patients, I make sure, or I recommend that they get a formula that has at least 35% boswellic acid content in it. So we want that standardized extract so we know there's at least that much boswellic acid, because that seems to be the main active constituent in boswellia / frankincense that seems to work the best. We also have to be using a high enough dose as well. Much to the chagrin of some people that post comments in my videos, I'm not able to post specific dosage recommendations for folks on social media. I'm just not allowed to based on my regulatory college, and quite frankly, you should get tailored treatment advice for taking some of these things, especially at higher dosages. But oftentimes patients will come in taking 1 or 2 capsules a day of a boswellia extract, and like sometimes we need to go like 4 times that amount, sometimes even more. So it sometimes requires quite a heavy-handed approach in order to get things under control before we see the symptom improvement, and then once things are improved, then we start to taper the dosage down. Another anti-pain agent that I found to be sometimes very helpful, some cases not helpful, but usually either, at the very least, usually moderately helpful, is something called palmitoyl ethanolamide, or PEA for short. It's kind of a not super well-known supplement, and again, it doesn't knock it out of the park for everyone, but if folks take a high enough dose, then it can be really quite effective for people, especially in combination with other agents. So the question that motivated this post or this video in the first place was specifically about tapering off of hydrocortisone, and there was kind of a part of that question asking about they had mentioned they'd seen a video of mine where I was talking about adrenal support formula number 2, which is a formula that we use at our clinic, and so it's a combination of adrenal gland extracts, so like bovine, or it's not bovine anymore, it used to be bovine, anyways, porcine, so pig-derived adrenal gland extract. There's a vitamin C in there, vitamin B5, there's some zinc in there, and then there's rhodiola, schisandra berry, Siberian ginseng, and ashwagandha. And so it's kind of a combination of herbal adaptogens and animal pig adrenal gland extract plus some cofactors for cortisol synthesis. So with the with adrenal, so the question was, is taking the right amount of or right type of adrenal support going to help with a cortisone taper? Bearing in mind that the adrenal glands make cortisol, which is kind of like the OG steroid, if you will, the original great. Sorry, my kids say OG all the time. Anyways, it's the original steroid. What all the steroids are based on is cortisol, and so that's what our adrenal glands, when we take things like hydrocortisone and prednisone and drugs like that, they are cortisol derivatives, essentially, or analogs, if you will. So I think the subtext to the question is, if I support my adrenals well enough, will I make enough cortisol that I don't need to take the hydrocortisone? In my experience, the answer to that question is typically no. That's not usually a successful strategy. Supporting the adrenals can be helpful for lots and lots of reasons. I love adaptogens. I love adrenal support formula number 2, but I haven't really seen that be an effective part of a cortisone tapering strategy. It's really more about why does a person need that hydrocortisone in the first place, and it usually comes down to more like addressing pro-inflammatory things that are happening in the body and getting rid of those root causes, and maybe again using some of those other things to taper or to help facilitate a taper. So I haven't really seen the comprehensive adrenal support make a big difference in that type of patient population. That's just my experience, though. If other folks listening, other clinicians that are listening, if you want to chime in with your experience, like, I'd love to hear it, but I just haven't really seen that move the needle a whole lot in my experience with those types of cases. If you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate appreciate it. So thank you in advance for taking a second to do that. If you have any questions on these topics or anything else, please post in the comment section below, and I will do my best to answer as soon as I can.